I'm so excited to see the baby, are you?
I can't wait to see our child.
The doctor's ready to see you, Lexi.
Okay.
Lexi.
Hi.
Hi, how are you?
I'm good.
I'm excited to see your baby today.
We're so excited.
Awesome. So it's your 16-week appointment, so we're going to find the gender and see if everything's developing, okay? All right? So let's take a look. Guys excited?
Yeah.
Oh, wow. Okay, so unfortunately there's some odd imaging in your ultrasound this week. As far as I can tell, it's indicating some form of spina bifida that's developing in the baby. Do you know what that means?
No, what's that?
So basically, you can see the spinal column right here. It's a failure for it to fuse correctly. So the spinal cord is exposed inside the baby, which obviously isn't normal. So there's a bunch of forms that I'm not specialized in, so I'm gonna have to recommend someone to come in and teach you guys more about like the different info about it, okay?
Okay.
Between the yellow lines is the opening of the spine. That's how we know it's myelomeningocele.
Hi, I'm Dr. Shepard. I'm Dr. Yang.
Hi. So Dr. Gray sent me here to talk about spina bifida with you guys because she said my baby has it, but are there any treatments and what is it?
Of course, spina bifida is the most common central nervous system birth defect in the United States. 1,400 to 1,500 babies are born with this defect in the United States each year. There are 4 different types of spina bifida. The most common form is myelomeningocele. In this form, the spinal cord and nerves push through the open vertebrae in the spine and through the baby's back while still in the womb. This can cause neurological damage because the spinal cord and nerves are constantly in the amniotic fluid while in utero.
The next form of spina bifida is meningocele. This is when the spinal cord pushes through the spine and the nerves are contained in a sac full of nerve fluid. In this form, there is normally no nerve damage, and babies with this type typically only have minor disabilities. The next type is called spina bifida occulta. This type is not as severe as the other types. 15% of healthy people have this and do not even know it. Spina bifida occulta normally does not cause harm and does not show visible signs. People find out that they have this type when they're older and because of different back injuries. It's found through x-rays of the lower back. However, even though most people do not have any signs of this form, some people do have pain and other neurological symptoms.
The fourth and final type of spina bifida is called oculate spinal dysphyrism. This type is found after birth from a dimple on the small of the infant's back. There's normally red spots, hyperpigmented patches, tufts of hair, and small lumps on the baby's lower back as well. Doctors will use a special tool and test to see if the child has this type. If they do, the spinal cord could grow wrong and cause serious problems for the child later in life.
Wow, that's a lot of information to take in. So what are the treatments and what are the success rates?
Sure, there are a few different treatments for spina bifida. The first one would be the most common treatment at the moment. 24 to 48 hours after the baby is born, he'll get surgery to repair the spot on his spinal column. However, some children's hospitals like CHOP are starting to do in utero surgery at 19 to 25 weeks to prevent any further damage on the spinal cord and nerves from constantly being in the amniotic fluid. The in utero surgery has a few health precautions that have to be taken into consideration before it's done because it's risky surgery for mom and baby. The gestational age of the baby, level of the lesions on the spine, and the health of the mother are some of the factors to take into consideration. The mother also has to commit to a prenatal repair treatment. Most babies who have the treatments live long and healthy lives. They need to be checked by a doctor every year to make sure they're still healthy and complication-free.
Spina bifida cannot be prevented, but taking folic acid in the first 3 months of pregnancy will help your chances of your baby having it go down. You can get 3 tests done to tell if the baby has it. The first is done at week 16 to 19 in the pregnancy. It's a blood test called an alpha-fetoprotein test. The level of AFP is 70 to 80% higher in women who are having a baby with spina bifida. The second test is an ultrasound. The third is called an amniocentesis test, where a small amount of fluid is taken from the womb to measure the protein levels.